Hey guys, it's Shadow the Rat, and for today's video, I unfortunately have some bad news about Miss Donut here, and you might already be able to tell something's going on. As you can see, she's not very coordinated. She is just acting kind of off. So I think she has a pituitary gland tumor, which is a type of brain tumor that is fairly common in rats. I say fairly common, but it's something like 20% of older rats. I think specifically older intact females will get them, although older males can also get it, and well, so can younger rats, but it's just less common in them. But pituitary gland tumors are awful. They are probably one of the worst things you can see in rats because the decline from them is just terrible. I mean, it really affects the rats physically, it affects them mentally. They're just completely out of it, and these tumors grow so fast that oftentimes within a few days your rat will pass away, or you will need to get them euthanized because they won't be able to do anything. They'll be like a vegetable. I mean, literally, they can't move, they can't, do anything but react to like light. And I've seen this, it's really awful. So, Donut here only started exhibiting these symptoms this night. She was just fine yesterday, but today she is clearly showing some weird signs, so I know that something neurological is going on. And like I said, I suspect a pituitary gland tumor. There are a few common things to look for with those. A big one's what's known as the Cheerio test. You hand your rat a Cheerio or something solid, and you see how they hold it. So a rat with a pituitary gland tumor often will not be able to really hold the item. So you can see Donut here is able to hold it, but she seems to be kind of having a little bit of trouble. This is pretty common if you catch the tumor early on. The rat might still be able to hold it somewhat, but as you can see, she's struggling. So not a great sign. On top of that, another big sign of pituitary gland tumors is if the rat is kind of not able to really walk well. They're kind of wobbly, they don't have great balance. You can see right now, this is a great example of Donut. She is sitting in a very unbalanced position, and this is not something a rat would regularly do if something wasn't going on. So she clearly has some issues going on. She's a little bit off balance, especially if she's like jumping off something, but honestly that's only going to get worse, unfortunately. And she's also kind of out of it. You can kind of see this here. She doesn't really seem to be as aware as usual. Sure, she's following the thing, but you can just look at her eyes. She has like this very dull look to her, which is very common with rats with these sorts of tumors. So it's a really awful thing to see. Donut is in the early stages, but unfortunately these tumors do progress very quickly. So within a few days, she could be gone. I am going to be taking her to the vet because there are some treatments for the most common types of pituitary gland tumors. And so I want to see if we can go ahead and maybe get a handle on this. Usually they first do a steroid shot, and this is just to reduce the inflammation in the brain as soon as possible, and this will help remove some of the symptoms. So the next thing you usually do is you put your rat on a oral steroid, and this is to keep the inflammation low. And you also put them on a antibiotic combo, usually Baytril and doxycycline, and this is to prevent any secondary infections from taking hold because steroids are an immune suppressor, so they suppress the immune system. Then on top of that, you also usually put your rats on cabergoline or bromo. I forget what the full name for bromo is, but basically both of these medications are known to shrink the most common types of pituitary gland tumors. Both of these are used in humans. However, of course, in the case of humans, if they don't work, then you also have the option of surgery, which unfortunately is not an option for rats because they're just too small. So you really have to hope that their tumor is one that is responsive to these medications. And these medications do have to be given daily in the case of bromo, or once every 3 days in the case of cabergoline. Both of them are something that your rat would have to be on for the rest of their life. You only have to give one or the other, of course. So it's definitely a bit of a lifestyle change in that case. But if they do work, then you can get back weeks or months of quality life, which for a rat is a long time. But yeah, I'll see what the vet says and see if they agree that it's a pituitary gland tumor. And if so, if they think that we should go ahead with treatment, I will of course be pushing for treatment if they think it's a pituitary gland tumor. So, that's going to be a bit difficult. It's just a really sucky thing for rats to go through. I hate seeing them just slowly kind of lose all their personality and everything like that. They just kind of, I don't know, they just stop responding to everything, and it's just absolutely awful. So I don't want to think about Donut going through that, because if she does, then likely in the next few days we'll see that happen. But right now, she is still responsive. So hopefully these medications will work, in which case I will be making another video and joining that to this one after the vet visit to kind of show you how she's improved, if that happens. So yeah, I'm not sure when I'm going to release this, but probably within a week of going to the vet. Because, well, after that point, we'll know if Donut is going to continue on medication or if we're going to have her euthanized. Okay, so that's pretty much it for this video. I will see you guys later, and please wish Miss Donut some luck because she really needs it after all her health issues. Poor girl. Hey guys, Shadow the Rat, and today is officially 2 days after the last clip you saw. That is to say, it is Wednesday night, and I filmed the first one on Monday night. So, a lot has happened in the last few days with Donut here, and some of it's good, some of it's not so good, and I'm going to go ahead and kind of discuss what's going on now. So I mentioned in the prior clip that I was going to take Donut to the vet in the morning, but the one problem there was that unfortunately it turns out my regular vet was booked. So one thing about my regular vet is that while they are really awesome with rats, they do not do emergency appointments. So if they don't have any vets available who are experienced with your animal, they won't take you on, which is a good thing, of course, because you do want to work with someone who is experienced. But it does also mean that you can't really go there in an emergency situation because in all likelihood you won't be able to get same-day appointments, especially if you have a pet like a rat where they only have a few vets who are kind of expertise enough to see them. So basically what happened is I tried to make an appointment for Tuesday morning, but the soonest they could get me in was 10 a.m. on Wednesday, which is today, the day I'm filming. And so I kind of had to be content with that, or I would have been content with that if Donut didn't drastically go downhill. So you can see her now, she seems a lot better, right? Well, that's because on Tuesday she crashed really hard. I mean, she became almost comatose. It was terrifying. I mean, she barely could move. She couldn't really walk. She couldn't really stand. She had zero interest in food. I mean, she didn't even want yogurt. I got her to eat like 3 licks of yogurt in half an hour. And that is nothing compared to how much she usually eats. Look at her right now. So she was very out of it. She was not responding to stimuli. She was just so out of it. So the second I saw that, I knew immediately we have to get her into vet right away, and we have to get a steroid shot for her. Because the thing with pituitary gland tumors is that typically the initial issues are actually caused by the inflammation around the tumor. So the inflammation causes pressure in the brain, which as a result causes all these symptoms. So the first thing you want to do is get your rat on a steroid, because steroids are anti-inflammatories, and steroids can also cross the blood-brain barrier, which is super important because that means they can get to the area they need to reduce inflammation in. You don't want to use something like Metacam because even though that is an anti-inflammatory, it cannot cross the blood-brain barrier, which means it's pretty much useless for a pituitary gland tumor or anything in the brain. So getting Donut a steroid shot was of the utmost importance, and I immediately started to call around and try to find a vet to get her in. I actually went ahead and called the general vet that I don't like going to because unfortunately they just aren't super experienced with rats, and they're really weird about medicating rats. I mean, it's so much of a hassle to get anyone there to prescribe anything for rats. They're good at like cats and dogs, and I do respect the vets there, but they're just not great with rats, and that is something that's like well known about them. And in fact, even when I called the front desk and I was like, hey, this is an emergency, can you get me in? She was like, well, we can get you in for an examination, but in all likelihood they won't be able to find out what's wrong because they're not super experienced with rats. And I mean, this is just something that's like known about this clinic. They are a cat and dog clinic. They see exotics if they have to, but you know, they aren't really prepared for exotics, so to speak. But what they do have the ability to do is give a dex shot, which is a steroid shot, to a rat. And I know because I've done it there before. And I've also gotten oral steroids from them before. So they do have the resources to do that. But getting them to actually prescribe a steroid is It's like pulling teeth. It's very difficult. Well, I guess I should more say that it's really difficult to get any vet to prescribe steroids for rats. I don't know what it is, but vets are just really weird about them. I understand maybe in some situations where, people might request them where they're not needed, and steroids do tend to have worse side effects. Plus, they depress the immune system, which means it's just not as effective, so your rat is more likely to develop a secondary infection. But that being said, there are some things that can only be treated with steroids, and the reason for that is because they need the medication to actually penetrate, again, the blood-brain barrier. If you can't get your medication to the source that it needs to get to, then it's pretty much useless. Anyways, all that being said, when I called the general vet's office, the lady at the front desk, like I said, did kind of warn me away from them, which, I knew about that, but it was nice of her. And she also helped me find another vet that was a little bit further away, but which does specialize more in rats and which does an emergency appointments. So that was really nice of her. So I ended up calling that vet, and they were able to get me in as an emergency appointment. They are about an hour away from me, so it was a little bit further than I was hoping to go, but, it was absolutely worth it for Donut, and so I went ahead and drove out there with her. And they only do curbside appointments right now at this place. In my town, they now do in-person again, but that's not the same everywhere, so I had to wait in my car while they took Donut in, and they examined her, and it took a while for them to get to her because she was an emergency appointment, so they were only able to see her after hours, and they closed at 5, and I got there at 3:40, so, I was waiting for quite a while, and unfortunately so was Donut. But she was really out of it, so hopefully it wasn't too bad for her. I mean, I'm sure she still didn't enjoy the experience of, being there for so long. I'm very grateful that they got me in and that they were willing to work with me. They were very insistent upon doing a full workup of Donut. I mean, like x-rays, blood panel, all that sort of stuff. And I was not on board with that. I mean, I did end up letting them do it because they really wanted to, and I, of course needed their help. But, it wasn't necessary. Like, Donut's symptoms aligned perfectly with a pituitary gland tumor, or if not that, then something neurological. And so there was no reason to do any other sort of workup on her because it wasn't giving us any relevant information. Because just based off symptoms alone, we had a few set causes, and because of one particular symptom, the way that she was losing mobility in both her front paws, we know that pituitary gland tumors are the most likely cause. So it just made no sense to go and do this full workup, which is not only extra stress on Donut, but on top of that, it cost $300. Yeah, it was really expensive to do this extra workup. And look, I'll do anything for Donut, but the fact is I've been to the vet 17 times this year, and that's since the summer. So not doing great in that department, okay? Obviously, I was prepared to take the rats to the vet. I have taken them to the vet, but I was not expecting this many vet appointments in such a short time period. So definitely not looking to accrue more charges. And I don't know, I guess I'm just a little pissy about that, not just because of the price, but because once they did the blood work, which came out just fine, as I knew it would, and the x-ray also came back completely fine, with the exception of some normal wear and tear due to age. That is to say, 2 of her spinal discs are slightly narrowed, which is something that does tend to happen in older rats. However, that does relate to the reason I'm so salty about this sort of extra charge and extra workup that I just feel wasn't needed, because as soon as the vet saw this, and keep in mind he is someone who's experienced with rats, his first thought was, hey, all these issues are because she's in pain because of the spinal discs. No, just no. It didn't match up. Her symptoms don't match up with just pain, okay? I understand that she could be in, some pain because of this issue, and potentially that could cause some, side effects. But the fact remains that she was going downhill mentally. Within the course of 6 to 8 hours, she went from being able to at least recognize her surroundings to being completely unresponsive to stimuli. That's not a pain response. That's some other issue at play. So I have no idea why he thought it was, just a pain response. But, it kind of made me pissed off because when he first called me, because keep in mind I was in the car during this time, so we were only able to communicate over the telephone. But when he first called me and, I was describing all these neurological symptoms I saw, and I was talking about some of my past experiences with pituitary gland tumors, and I was just talking about treatment options, all these things I was talking about and how they aligned with her symptoms. He heard all of this, and then somehow, as soon as he saw the spinal disc thing, it was like he just narrowed in focus there and was like, you know what, it's probably a pain issue. The fact that she's barely able to move and had all these neurological symptoms like, difficulty holding things in her paws, that's just a pain thing. It clearly can't be any sort of brain tumor. I just felt very unheard in this situation. And he really was trying to push me to get Medicam, which is an anti-inflammatory, but like I said before, it doesn't cross into the brain. So it's completely ineffective for any sort of brain inflammation. And the other bad thing about Medicam is that you can't use it at the same time as a steroid. And in fact, the rat has to be off of Medicam for over 48 hours before you can put them on a steroid. So you can kind of see the problem here. If we start with Medicam, which is the less intensive treatment, and which can treat pain, but it ends up being something that needs a steroid, well, we'd have to wait until 48 hours after we finish the Medicam, which if it's a pituitary gland tumor means the rat would already be dead or severely gone to the point where they likely can't recover even with treatment. So you can kind of see why I'm so salty here, because if I took his advice, Donut wouldn't be alive, okay? She would probably have to be euthanized at that point because we wouldn't be able to do anything for 48 hours and she would probably just pass. Or she would have needed to be euthanized because she would just be a vegetable. She would be gone. I mean, just lying on her side, completely unresponsive to any stimuli, just completely gone. And this is just an issue I found with so many vets. They're so weird about steroids. I don't know what it is. Like I mentioned before, like so many vets are just completely against trying steroids except as a last resort. The problem is, if you need to use a steroid, well then the situation is usually something pretty dire and time sensitive. You're not looking at something that can wait a week to try it. You're looking at something that you usually have, a day or two to try it. Anyways, that's kind of the main reason I was not super happy about this vet visit. I mean, it just really felt like he was trying to push me towards this one treatment. And yes, in the end, he was willing to try the dex shot and the prednisone, but, it took a lot of talking around and kind of pushing a little bit. And the thing is, if I wasn't willing to push and I wasn't, pretty sure with what we were dealing with, then I might have gone with his recommendation and Donut probably wouldn't be alive still. It's just such a difficult thing to talk about because I really appreciate vets. They do a very difficult job, but there are just some very strange, limitations I found to some of the treatment options that a lot of them are willing to try, and I just don't really understand why. So yeah, I did end up convincing the vet to give Donut a dex shot, and dex is a steroid. I will have the name on screen. I cannot pronounce the name, so we're just going to put it on screen. Dex is the shortened version. But shortly after the shot, I'd say about 3 hours afterwards, she was already starting to perk up and actually show some, awareness. She wasn't just lying on her side anymore, which is really good. And then about 8 hours later, she started to eat solid food. That was freaking amazing because she wasn't even eating liquid food during the afternoon. Like, there was a period of time where she wouldn't take anything in. She could barely swallow. I was really afraid that if I tried to give her something orally, she would aspirate on it. So seeing her start to eat solid food 8 hours after the steroid shot, just amazing. Super quick turnaround time. 14 hours later, she was eating solid food like a pro. And then 20 hours later, she was pretty much completely back to normal, running around, jumping, all sorts of stuff. It's now been, I want to say, a little over 24 hours, and she is doing absolutely amazing. So I am very glad that I pushed for the dex shot, and I'm also very glad that they were willing to give it because I'm pretty sure that otherwise Donut just wouldn't be here anymore. Now, on top of that, they also gave me 2 weeks worth of oral prednisone. She gets that twice a day. And she also has doxycycline, which is an antibiotic. The reason you give that with steroids is because steroids do depress the immune system. So in order to help prevent secondary infections from taking hold when the immune system is compromised, you put the rat on a general antibiotic as well. Sometimes 2 of them. But in Donut's case, because she doesn't have a history of respiratory issues or other infections, they felt like just 1 was enough. And we'll just, reassess that if necessary. But anyways, after all that, I was finally able to take her home. It took about 6 hours for us to go through the whole experience, which was quite a lot, but it was definitely worth it because Donut made such a recovery in that time, and I really feel like she wouldn't have made it if I waited until, this morning, which is Wednesday. Now, I did decide to keep my vet appointment at my regular vet, too. So I actually did take her in this morning because I just feel more comfortable with this vet, and I feel like they're more willing to try, the necessary treatment options. And they're not going to push ineffective treatment options on me. So I just took them in, and they were super great. I actually got to go in, which, is a really big benefit because it allowed me to show them the videos that I had taken of Donut during her decline into more and more symptoms. And they agreed with me that it did look to be a pituitary gland tumor. Either that or a general brain tumor was the most likely option. But because general brain tumors typically affect one side, you'll usually notice that the rat is weak on one side and fine on the other. Because Donut's symptoms are bilateral and they affect both sides of her front paws, and just both sides of her body in general, it does seem to point more to a pituitary gland tumor because that is kind of the most common sign of those. Anyways, like I said, my regular vet did agree that it did seem to be most likely a pituitary gland tumor, and he was also very glad that we pushed for the steroid because it was really important in this case, as he basically told me there's no way you'd see such a quick turnaround without a steroid, especially not in this situation. So yeah, he was very pleased to see that she was on a steroid and that she was doing so much better. And, I had those videos to show what she looked like so he could see just how much she had improved. And on top of that, I also discussed adding in cabergoline to Donut's medicine regimen. Cabergoline affects certain types of hormone-based tumors, and it will slow the growth of them and also sometimes reduce the size. So this can give you more time because, the tumor isn't growing as quickly. So you obviously want to keep the rat on a steroid at the same time to reduce any inflammation in the area. You're basically trying to reduce pressure in the brain as much as possible because, the fact that the brain is so small and enclosed in the skull means that you don't have much room for anything new. And as soon as something new, like a tumor, starts growing, then the pressure builds up really quickly. You really want to reduce the inflammation and you want to slow the tumor growth if possible. So usually the way that you go about treating pituitary gland tumors is you start with this dex shot, then you put your rat on oral prednisone and an antibiotic, and then on top of that you put them on cabergoline or bromo. One needs to be given once a day, that's bromo. It's also the more cost-effective medication in most cases. Cabergoline, on the other hand, needs to be given once every 3 days, but it is quite a bit more expensive. Unfortunately, in my area, cabergoline is the only one available, and so that's pretty much what I have to go with, and, that's okay. It is, again, for Donut, so it's absolutely worth it, and I have gotten cabergoline before from the place I'm getting it. Actually, I was supposed to get it today, but it turns out they weren't done compounding it, so they're going to finish that up tomorrow. It's not super important that we start that right away, because the main thing we had to take care of right away was the inflammation caused by the tumor, and now that that's down, you can see that Donut's behavior has improved so much. And that's really the most important thing right now, keeping inflammation low. And then when we get cabergoline, hopefully she'll have a tumor that is responsive to it. If she doesn't, then the steroids will still help. But hopefully the cabergoline will help too, because that way we'll get more time with her than if it's just, a case of us being able to reduce the inflammation. Anyways, that is pretty much it for this update. I am very glad that I was able to see my regular vet, because not only did he, confirm the diagnosis, but on top of that, he was able to prescribe cabergoline, and then he also is going to be giving us prednisone for the future. That is to say, once we run out of our current prednisone, he is going to, prescribe us more for the future, because Donut will have to be on it for the rest of her life. Now, as far as lifespan expectancies, this is really an impossible question to answer because each pituitary gland tumor is going to grow at a different rate, and depending on if the tumor is one that responds to cabergoline or not, that's also going to affect growth rate a lot. So we really just don't know at this point. Hopefully we'll have at least a few weeks. Maybe we'll get a few months if we're really lucky. It's really impossible to say at this point, but I'm hopeful we'll have some good quality time left. Right now, Donut is doing really well. She responded to the dex shot super quickly. Oftentimes it takes a day or two to really kick in. So the fact that she responded in a few hours is a really good sign, at least as far as, us catching it early and her symptoms mainly being just due to inflammation at this point. But ultimately, these tumors are always fatal, so you do have to keep that in mind. But, Donut is an older rat, so even if she only has a few weeks left, she will have lived a quality life, and I would much rather her last few weeks be quality and, on medication like this, than just her suffering for the last few weeks. But, she wasn't treated for the pituitary gland tumor, she likely would pass in a pretty terrible way, because the way that rats decline from these is just absolutely awful. I mean, it just affects them physically and mentally, and it also just makes it kind of impossible for them to eat eventually, so then they're kind of starving to death, and it's just, it's the worst thing to see, and I've definitely waited too long to euthanize before with one of these, so I'm just going to keep a really close eye on Donut to make sure that I don't make that mistake again. For now, she is doing super well, and she is just so happy and just looking really good, so I'm so glad we got a head start on this. I'm glad I pushed for the steroids, and I'm just very happy to see Donut back to her usual self. So yeah, that's pretty much it for this video. I know it's pretty long. I'm not going to put any more updates here because I've already spoken a lot. Hopefully this video is informative for, other people out there with rats with pituitary gland tumors. There are some treatment options that can give you back a little bit of quality time, and it is worth pursuing these if possible. So, I'm definitely going to be continuing to keep you updated on Donut, and here's hoping that, we still have some good time left with her. Okay, so that is it for this video, and I will see you guys later. Bye!